Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care, fast. Healthcare just got less painful.
The new Red Bull Dragonberry Energizer is now at McDonald's. Made with freeze-dried dragon fruit. And made to lock in. The all-new Energizer, now at McDonald's.
We live in a time where the average person has more access to information than ever before. Advancements in science have given mobility back to paralyzed patients and allowed for 3D printed organ transfers. Incredible discoveries are being made when just a few years ago, those same ideas were believed to be science fiction. So why then, with all of these achievements and seemingly endless streams of funding, does America still have much worse health outcomes compared to other similar countries?
The problem is people don't have access to a primary care doctor, someone who can understand their particular health goals, their particular health questions, and their needs, and then make a plan based on who they are, not just their diagnosis codes. So people are walking around with tons of information, step tracker information, sleep tracker information, internet gurus, and prescriptive advice, everywhere you look, but without a sense of who to trust.
That's Dr. Lucy McBride, primary care physician and author of Beyond the Prescription, a doctor's guide to taking charge of your health. A 2023 report reveals that more than 100 million people don't have a primary care provider. That's nearly 1/3 of all Americans, including children. A lot of healthcare is segmented into specialties, and though these play an important role, primary care is where all of that segmented information gets pieced together and made sense of as it affects the patient as a whole.
As it was conceived, primary care was supposed to be a hub for problem solving, a place where patient and doctor partnered, where conversation was the commodity, relationship was the commodity. So then patients are empowered, and then referrals are needed only when you can't solve a problem in-house. But the way primary care is now is either it's inaccessible, or patients are given 15 minutes, they're rushed through an appointment, they're treated like a bag of organs through no fault of doctors. The system just isn't designed for patients and doctors. It's designed for volume and for transactions. And so it's no surprise then that patients feel very disenfranchised from the medical system.
Even patients that do have a primary care doctor are having issues getting in to see that physician. Suddenly, patients are going to the ER for an acute problem that could have been more easily solved by their family physician.
The ER can triage your chest pain well, but if your chest pain started when your mom was diagnosed with cancer and there's no ER evaluation that's going to help you countenance like stress and anxiety that affects your chest just like a heart attack can.
McBride says this disconnect has redefined health as data and tests instead of the accumulation of a patient's experiences. But it's still possible for patients to take back control and get the most out of their 15-minute appointments. Her new book helps people explore what they want out of the healthcare system, starting with the simple idea many of us haven't thought to ask: what does health look like to me?
So the most important data for your health doesn't live in a lab test. It's about who you are. It's about your fears, your vulnerabilities, the things you are embarrassed to say out loud. It's about your sleep, your stress, your relationship with food, your relationship with alcohol, your relationship with your mother. Like all those things inform how you think and feel and behave every day. So if you don't understand how you define health for yourself, like what is a healthy day looking like to you? What do you want to be doing in 5 years or 10 years? You run the risk of your health being defined for you as a set of lab tests, or in the wellness space, a sort of protocol that someone else decided is what you need.
It can be easy to get swept up in the latest and greatest product, but suddenly you end up spending a lot of money on things you don't actually value. McBride says that having a concrete set of values and expectations when it comes to your own health helps doctors give more informed and personalized recommendations.
some patients want to kind of optimize every body part at all costs. And other patients are like, look, I want to be natural and not take prescription medications, sometimes at my own expense. So it's not for me to decide as a physician what your tolerance for risk is or what your particular health goals are. It's for me to understand who you are so that I can layer my expertise onto your goals, right? Like not everybody wants to live the same way or has the same expectations for their health.
Defining your health is the first step to transforming your relationship with the healthcare system. The next phase McBride writes about is taking inventory of your health ecosystem. This is the intersection of your physical, emotional, and spiritual well-being.
It's not just about what you eat, it's about your relationship with food. You may be somebody who skips lunch because you're too busy, and then you're kind of inattentive and distracted and anxious at work all day. And you go home at night, you eat whatever's in sight, you drink some alcohol to take the edge off, you don't sleep well, and you wake up the next day and do it all over again and tell your doctor you're fatigued. Well, we need to know that you're skipping lunch and overeating at night because you run the risk of getting a whole set of lab tests when all you need is lunch.
Which is why being aware of all your experiences is important. McBride divides this ecosystem into 4 sections, starting with the informatics of who you are and the inputs of what you consume.
All the things you put in your body, from kale and quinoa to alcohol and marijuana, all the things you put in your health ecosystem, your infrastructure, your physical container, like the vehicle that you're carrying and driving through life that you cannot trade in. You have to take care of your skeleton like you do your car. And then 4th is your insight, your mental health, your relationships, the story you tell yourself about who you are, your worthiness, the shoulds, and your cognitive health. So the health ecosystem mapping process is about prompting yourself to map this whole system so you can bring a more authentic rendering of yourself to your doctor or to yourself every day when you're making mundane or important decisions about health.
This authentic image is a good foundation for McBride's 3rd step to getting the most out of healthcare, which is understanding your patient personality. It's taking an honest look at how you show up in a medical setting.
We all have patient personalities. I do too. And this is not good or bad. It's just a way of reflecting on yourself to understand how you process information, how you handle authority figures, and how you take or leave advice. So are you the optimizer who believes that health is defined as like willpower and brute force, and you can optimize your way out of any health problem? Are you the people pleaser who thinks if they could just dazzle their doctor, then everything would be okay? You tend to minimize symptoms and just want to get out of there with a clean bill of health. Are you the internet warrior who comes into your doctor with spreadsheets and reams of data and a lot of anxiety? Or are you the outsourcer who doesn't really want to know why or any mechanism? They just want the prescription, the pill, and they want to get out of there.
You won't perfectly fit into just one category. We're all composites of these different profiles, but the goal is to take an honest look at ourselves so that we can lean on our strengths and understand our weaknesses. Having a clear idea of your patient personality can help both you and the doctor get the most out of the experience.
A people pleaser might then come to the doctor knowing that this is their personality and say, Doc, I tend to minimize my symptoms and I really don't want to bother you. So when I'm talking about this fatigue, can you make sure you're just asking me extra questions because I don't think I'm necessarily going to bring things up. And some of it is embarrassing. And so you're then setting yourself up for a dialogue instead of just sitting there and passively consuming information and getting out of that appointment without getting what you need.
Now, a people pleaser may not even bring up this concern for fear of annoying or insulting the physician. However, McBride says that doctors actually love this self-awareness from patients.
It's much more interesting as a doctor to be told, like, hey, this is how I am. And I might, or like, it's wonderful when a patient can say, like, I'm probably not going to take that prescription. So like, convince me how much I need it. Or like, I know myself, I don't like pills, but I respect you. Tell me what you think would convince me I need it. You know, that's really helpful.
Knowing who you are as a patient will make you much more comfortable in these situations that can often feel overwhelming and vulnerable. It also makes it much easier to ask for help, which is McBride's 4th step in this process. Unfortunately, you may not like every answer you receive. A big part of being human is recognizing that there are so many factors that are out of our control. McBride says it's extremely important to be able to develop the ability to accept what you cannot control so that you can give all your energy to the things you can.
Let's say you have a genetic predisposition to heart disease. Okay, you can't change your genetics, you can't change your gender or your age, but there's so much agency you have over your health, your heart health, if you understand by partnering with a doctor and understanding your goals and your limitations of your life, how exercise and healthy habits and alcohol cessation, stress management, even sleep can improve your cardiovascular health. So if we are trying to exercise our way out of a genetic predisposition and not accept that that's just a fixed reality of our life, then that's called denial. And when people have their eyes wide open to the realities of the unfortunate parts of their lives, their past, their genetics, some circumstances they cannot change, it actually opens the door to allocating your energy, time, and resources to the places where you do have control.
Which is why practicing acceptance is the final step in becoming a better patient. Now, it's a lifelong process, and it doesn't come naturally to many of us, but McBride argues that living in denial will waste so much of your time, efforts, and resources. Accepting the reality of a situation allows you to find other avenues to success instead of beating on a locked door that's never going to open.
Now, that's a hard concept, but that's the process of being alive. So there's no supplement that's going to help people accept like a cancer diagnosis or something traumatic that happened in their past. It's work, it's effort, but that is where dividends are paid in health.
Which is the goal of McBride's book. It helps readers personalize healthcare to fit exactly what they need, making the complex and broken system work better for them.
The goal is to help you take an honest inventory of all the data that is housed inside you. Your doctor is never going to have time to elicit from you. And then use it the way you need, even in your everyday life, but certainly in a medical appointment when a doctor is saying, look, let's say a doctor says you need to lose weight or you need to be on a cholesterol medication. You can then say to them, hey, you know what? I first need to work on my relationship with food, the structure of the way I eat, and my stress. And then can we give it 3 months? Because that's what I want to work on first. Because you've done the homework and you understand that managing cholesterol and weight isn't just about prescriptions.
Her book, Beyond the Prescription, is available now wherever books are sold. You can find more information about Dr. Lucy McBride and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our executive producer is Amira Zaveri. I'm Kristen Farrah.
I'm Sam, owner of Marino's Landscape. With my Chase Ink Business Premier Card, I earn unlimited 2.5% cash back on purchases of $5,000 or more. So everything I buy to run my landscaping business gives me cash back to help throw a big thank you party for my team. For all they do.
Chase Ink. Cash back built for every business. Find the right card at chase.com/ink. Real business owner compensated for their participation. Cards issued by JPMorgan Chase Bank and a member FDIC. Subject to credit approval. Terms apply.
What are the ingredients for childhood? Well, start with a handful of Annie's fruit snacks, where the #1 ingredient is real fruit. Add a dash of basement pillow forts and a serving of Annie's Super Mac with 15 grams of protein. Add a sprinkle of hide and seek.
Ready or not, here I come.
Then top it all off with wholesome ingredients for every bunny. Annie's, ingredients for childhood.